What's your name?
Samara.
And how old are you?
I'm 9 and I'm turning 10 in November.
So last week, there was news that Pfizer might be available for children
Yeah.
between the ages of 5 and 11.
Yes.
You saw this on the news?
Yeah, I did.
What was your reaction?
Hooray.
Why?
So I can go on trips again. I also want to go play more and more and more.
But you want to get it, right?
Yeah.
Why, though?
Well, it's less of a chance to get COVID.
Yeah.
So there's the reason.
From the Toronto Star, I'm Reggie Mudler, and this matters. Parents have been waiting for news about vaccines for younger kids. We recently got some and wanted some reaction from this demographic. We wanted to do the classic person on the street interview, although this time it was really more of a kid in my home report. You just heard my usually needle-phobic 9-year-old ready to roll up her sleeve. The recent news from Pfizer leads to all sorts of questions about efficacy, side effects, and timelines. For all that we know now, we are joined by Alex Boyd, who is a Calgary-based reporter for The Star. She's been on the vaccine beat for much of the pandemic. She joins us once again to talk about the latest news and what we know about vaccines for kids. Alex, thanks so much for joining us once again.
Thank you for having me.
Okay, Alex, I'm a parent. This is the big news I've been waiting for. What is Pfizer saying about vaccines and kids?
Yes, very exciting news for kids. So the news we heard from Pfizer last week is that they've got a first look at some of their results for how their vaccine works in kids aged 5 to 11. And what they're seeing so far is that it seems to be safe, it seems to have minimal side effects, and it seems to generate a similar immune response than it does in people who are just slightly older. So again, we need to see these results actually be published. We need to see them be vetted by other scientists just to make sure that, our due diligence is here. The regulatory body, of course, will do the job that it does in making sure that it's safe for kids. But at this point, it's a really promising sign that a vaccine for younger kids could be in sight, could be available to kids and their parents within a matter of months.
This was one of the studies that I was just waiting for. We kept hearing it was going to come right about now, end of September. Can you just talk a little bit about the specific trial that the conclusions came from?
Yes. So this trial was done on just over 2,000 volunteers, somewhere in the neighborhood of 2,200 kids. They were all aged 5 to 11, and they were from the US, Finland, Poland, and Spain. And so what Pfizer did was they looked at a slightly smaller vaccine dose. So the dosage that these kids are getting are about a third of the dose that adults have been getting. And so they were given this dose. And again, they were looking at, is this safe? What do the side effects look like? And what sort of immune response does this promote? So is it creating antibodies? Does it seem to be having that same effect of teaching your immune system to fight off the virus than it does in slightly older people? And so I know some people have asked questions about why it was only about 2,000 kids, because obviously when these vaccines were first developed, they were developed on tens of thousands of people around the world. This is a much smaller study. But the reason for that is because this is what's called a bridging study. So this is what you do if you already have a vaccine or a drug that's available to a lot of people in the world, and you just want to extend the eligibility for it a little bit. And so what they're trying to do is say, okay, we're going to look at how this vaccine does in these kids aged 5 to 11, and we're going to see, is it similar to people who are just a little bit older? So those people who are 16 to 25, because we've got a lot of information on the 16 to 25 age group. And then if you can say, okay, the vaccine seems to be safe, it seems to be generating a similar immune response to people who are just a little bit older, we can then assume that it's going to work in a similar way. Because while it doesn't probably make a lot of sense to compare your toddler's immune system to, say, an 80-year-old, we do know from an immune perspective that you can compare someone's immune system at the age of 12, 13, and it's not that dissimilar from someone who's aged, 21, 22. So they're trying to say, is it the same as people slightly older? Okay, then it's going to be okay to roll out to a wider group.
I just want to be very clear about this. So it's a third of a dose of what adults get. It's a double shot as well. This was one of the big things that they were testing for, this correct dosage for kids, right? This is the thing you got to figure out, and now they think they've got it. Yeah?
Exactly. Because the reason why you want to give them a smaller dose is because you want to reduce the effect or the chances of side effects. So you want to give them as little amount of the vaccine as you possibly can. And so the amount that they arrived on that seems to work is about a third of a dose, a third of an adult dose. And that the one that they're trying on kids younger than 5 is actually even smaller yet. So yeah, they're trying to dial down on that perfect balance between giving them enough, but minimizing those side effects.
Let's talk about those side effects. Are they different in children? Is the vaccine hangover that adults complained about, is this going to be the first time my kid has one of those?
We don't know yet. I think it's important to be clear about what exactly we know. So there is going to be more information when the full study is published, when it's put out in a medical journal. But right now, what we know, what Pfizer is saying is that side effects are very similar to that age 16 to 25. And so what we know from those lucky folks, 16 to 25, that are already getting the vaccine is that they're seeing things like pain at the injection site, muscle soreness, fatigue, those symptoms that many of us in the adult category are already well familiar with. So it does look fairly similar, but again, we're going to be looking for those specific details when the full study is published.
So 12 to 17-year-olds, 16 to 25-year-olds, many of them had the shots. What have they learned from that younger age group that they can extrapolate for the even younger one?
What we know at this point is that good things like it seems to be relatively safe, side effects seem to be relatively mild. They are watching things like the risk of myocarditis very closely. That is something that is a very rare risk that has now been associated with the mRNA vaccines. And when I say rare, we've heard from Dr. Tam that we're looking at 1 in 100,000 for Pfizer, 1 in 50,000 for Moderna.
Define what that is exactly.
Good point. Myocarditis is essentially inflammation of the heart and the surrounding tissue around the heart. So it is serious, but we do know that most people that have had this complication have made a full recovery, but we do know that it's slightly riskier in younger populations. So again, it's not a huge risk, but it is something that Health Canada is going to be watching.
Okay, I want to sort of clear out a bunch of misinformation because I thought your piece had some good things that, the world was obsessed with Nicki Minaj and testicular gate. One of the questions that you asked is, does this affect puberty? And is there anything else that sort of you want to get on the record out there?
I wish the health minister of, was it Trinidad, would go on the record to dissolve us of all of our vaccine misinformation issues. But I appreciate that he addressed that one. But we are seeing some issues around misinformation as it relates to kids. People have questions about, does this affect growth? Does it affect puberty? And at this point, there is no evidence, according to the experts that I've spoken to, that this has anything to do with your child's development. And so, again, this information floating out there, it is particular to kids. But I think, when in doubt, talk to your doctor, talk to a health professional who is really familiar with what the research says about these vaccines.
We'll be right back. Okay, we should really take this sort of big caveat because we're watching science in real time. This is, again, a study or trial from the manufacturers, and right now we've only heard from the manufacturers, right? What more do we need to hear before what they're saying is validated?
Correct. Yeah, this is a great example of something that we've seen a lot of during this pandemic, which has been termed science by press release, which is when a big scientific development in the vaccine or in any sort of healthcare development goes out because the company says it is so. And, it's nice to know where they're at. I think this has given a lot of hope to a lot of people. But you're right. It's very important that people know that the full scientific authorization process here is now kicking into gear. So what that means is the full study is going to be published in a scientific journal. That means all sorts of other experts get to look at the data, make sure it makes sense to them, and kind of, say yay or nay about whether or not they think this makes sense. The other really important thing that's going to happen here is the Health Canada authorization process. And so I spoke to Pfizer this week, and we know they've already applied for regulatory approval in the US. They haven't quite got to that point in Canada yet, but we know that they've already been submitting data to Health Canada, which means their whole stable of experts is going through this information and making sure that they are very clear on what's happening, very clear that it works, and very clear that it's safe. And so Health Canada is going to make sure that they do all that work before it's authorized for use in kids.
So what happens next, and what do we know about those approval timelines?
Right. So, as mentioned, Pfizer has applied for authorization for kids in the US. That doesn't necessarily mean we're behind in Canada. The two regulatory systems are a little bit different, but we do know that they don't have a timeline yet for exactly when they want to apply for official authorization here in Canada. They're already talking to Health Canada and they're hoping for an application in the coming weeks. And so what we've heard from Health Canada is that they're hoping to make a decision as early as the end of this year, potentially early 2022. But we are looking at something that could be available end of this year, beginning of next.
Okay, then, what do we know about rollout plans? I saw Toronto Public Health sent out a press release about this already. As a parent, is this something that might be done in schools? Like, are we there yet?
What we do know is that they're starting that process. They're starting to think about it, which is great because I think rollout for kids is obviously going to be a challenge and one that's really important that we do it well. And so what we do know is that, they're looking at some of the things they did for older teenagers. So they, did things like put them in doctor's office and put them in pharmacies, which they did for adults, but they also did things like reach out to schools and do school specific immunization clinics. So that's the sort of thing that they're looking at doing logistically to make sure that we can get these out quickly. The other thing that they're looking at, though, which is also super important, is making sure that people have the information they need to make a decision they can feel good about. So they're looking at putting out information in multiple languages. They're looking at doing engagement with parents at schools, just making sure that people have the information so that, again, this is a decision that we all got to make for ourselves as adults, just to make sure that people are able to make the decision that they're comfortable with for their kids too.
Do we know anything about the other vaccines and where they are at in this process of getting their vaccines ready for consumption by children?
We do know that they're all working on it. A vaccine for kids at this point is a big priority for these companies. So, for example, we know Moderna, which has already been authorized for 12 and up in Canada. They're full into their trials. They're looking at a regulatory application end of this year, early next. We know AstraZeneca and Johnson & Johnson are also prepping vaccines for younger kids. They're a little bit further behind because they're not yet authorized for 12 and up, but it is something that they're all looking at. So we can expect some more regulatory applications kind of towards the end of the year. And then, fingers crossed, we could be in the happy position next year of where we're at now for adults, which is having a selection of vaccines available for kids.
I'm a freaked out parent, so it's very much important to me. But one of the things we've heard throughout this is that COVID just isn't as bad in children and affect them as badly. But of course, I think this is really also becoming a more pressing issue. Just like we've seen in the US, there's a huge spike in children getting COVID and then getting long COVID. In Canada, this remains the largest age group and cohort that has yet to be vaccinated simply because they can't. Is this the most important thing right now in terms of this?
I think it is really important. And I think it's really important that experts have spoken out against this idea that just because COVID is less risky in younger kids, by which I mean you're less likely to, have serious complications and die from COVID if you're a child, it's not no risk. And so, something we heard this week from Toronto public health officials that I found quite striking is that right now, the demographic that has the highest rate of COVID is actually kids aged 4 to 11. So right now, 64 cases per 100,000 kids per week is what we're seeing in that demographic. And I know that's a lot of numbers to throw out, in an auditory medium, but what that says is that the people currently getting the most COVID cases or more COVID cases than other demographics is those younger kids. And so, yes, they're less at risk for serious complications, but there is a risk. And when you multiply that with more kids, you're still going to end up seeing kids with serious complications, kids landing in hospitals. The other thing, too, is that as we see restrictions start to loosen, as more people get vaccinated, it means people who are unvaccinated are going to be at higher risk because the virus is going to continue to circulate. So again, that's putting our kids at risk here. So when you look at the higher risk potentially moving into fall, and then things like you say, kids can get long COVID. A recent British study said as many as 4% of kids and teenagers still had symptoms a month after getting infected. That's not nothing. They can get multi-system inflammatory syndrome in children, which is kind of a reaction to the vaccine that's relatively unique to young people. To sum up, it's lower risk for kids. It's not no risk. So it's important for their safety that we start getting this moving. And then, of course, I think all of us, regardless of your position on children, want this to end. And if we want this to end, we need the virus to stop circulating. And so making sure that kids are vaccinated, they're not, harboring pools of virus is going to be an important part of ending this pandemic for all of us.
I let you know with my 9-year-old daughter when she saw the news about this. She literally screamed in joy. And like any kid, she hates needles. She doesn't want to do it, but I mean, she knows how much we wanted to get vaccinated, and now she really wants to as well. So I'm hoping that other parents will have the same sort of boisterous joy at this news. Alex, is there anything that I didn't ask that you think our listeners should know?
I think that about covers it. I think it's just, maybe important to hit that point one more time is, it is important that kids have this conversation about vaccination. Just because they're low risk doesn't mean they're no risk. But at the same time, I think a lot of us kind of had to do a lot of reading and a lot of thinking about our own vaccinations decisions. And so, I recognize that this is going to be a challenging one for parents. So I think it's just important that you talk to your medical professional, whoever that might be, get the information that you need, make sure that you can make a decision that you feel good about, and really hoping that a lot of kids have a reaction like your daughters and are just very excited to get vaccinated and finally feel a bit of that protection that a lot of us luckily got months ago.
Alex, you mentioned it right before we started talking, and I think it was a really interesting point in that none of the materials are really aimed at children and convincing them about the benefits of a vaccine. Can you talk a little bit about that and sort of how that came upon your radar?
Yeah, it was not something that I had been thinking about, but then a friend of mine reached out to me, and he has two daughters who are preteens, I think getting into their teen years, and his kids are super smart, super educated, and they have their own minds. They wanted to make a decision for themselves. And so he reached out to me asking if I had any information that they could read, because, in as much as, he wanted them to get vaccinated, he knew it was important for them to make their own decision for themselves as well. And so there isn't a ton of great information out there for kids to make this decision for themselves. But I think it really is important to acknowledge that, in as much as it's your job as a parent to take care of your kids and help them make these decisions, I think it's important that, kids have their own minds and they're going to want to know about this too. So hopefully we'll see a little bit more information out there specifically aimed for kids, because they should be able to feel good about this decision as well.
That's a great point. Alex, I really, really want to thank you for your time today.
Thank you.
Alex Boyd is a Calgary-based reporter for The Star. That's it for today. Thanks so much for joining us. I'm your host, Raju Mudder. Our This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachneck, Saba Etizaz, and Sean Pattenden. Our music is by So-Called, Mike DeAngelis, and Sean Pattenden. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.